Diagnostics for COVID-19. COVID-19 diagnostics are tests used to detect infection with the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2 virus, the causative agent. Nasopharyngeal swabs are commonly taken for COVID-19 diagnostic testing. Other samples include sputum, blood, stool, urine, and bronchoalveolar lavage. Samples may be taken at a hospital or clinic, or at home, by a visiting healthcare professional. The samples are then sent to a laboratory for testing. It will usually take around 72 hours to receive a result. Three types of tests are performed for COVID-19: molecular tests, antibody-based and antigen-based immunoassays, and non-disease-specific tests. Molecular tests are diagnostics that detect viral genetic material, usually performed in a laboratory due to equipment requirement, and is based on polymerase chain reaction. It is used for testing people suspected of having COVID-19. A positive result confirms a current SARS-CoV-2 infection. The antibody-based immunoassay test detects the presence of antiviral antibodies and is based on enzyme-linked immunosorbent assay. It may be laboratory-based or performed at point of care, depending on test design. The test helps to assess overall infection and immunity rates in a community. A positive result indicates a recent or past infection and could be used to screen for current infection. The antigen-based immunoassay detects the presence of viral proteins and is based on technique called enzyme-linked immunosorbent assay. It may be laboratory-based or performed at point of care, depending on test design. It is used to test people suspected of having COVID-19 or screening, triage to identify candidates for further testing. A positive result confirms a current SARS-CoV-2 infection or suggests a potential infection. Non-disease-specific tests help detect signs and symptoms of disease. The techniques include thermal scanning to identify people with a fever and CT chest scans to distinguish from other chest infections. The tests are usually performed outside of the laboratory, in clinic or at point of care, depending on equipment needs, and helps in screening and triage to identify candidates for further testing. A positive result suggests a potential infection and indicates the need for further testing. SARS-CoV-2 is part of the coronavirus family. Molecular tests for COVID-19 are based on genetic sequences from the SARS-CoV-2 viral genome. Tests can use sequences that are unique to SARS-CoV-2 to distinguish from infections with other human coronaviruses. There are currently 2 known strains of SARS-CoV-2, which are thought to have different infection rates and severity of disease. Tests can use sequences common to both strains to ensure that they can both be detected.